Lynn Pillay.
Thank you very much, Mr Speaker. And I want to firstly take up some points that the previous speaker, some of the quotes actually that the previous speaker used. And I think I heard, and people will correct me if I didn't hear that, but bang for the buck. The term, we want to see the best. Exactly, says the member. What does that mean? And I think that is the whole principle here. Maurice Williamson doesn't know what it means, and he's supposed to be a noter in the National Party. The bang for the buck is actually about the redistribution of what happens in terms of the policies of the national government. And if we look at the bang for the buck, let's look at the bang for the buck that we've seen currently. We've seen cuts to ACC, to victims of sexual assault, to people who have been injured at work, who aren't getting back to work, to people who are hearing impaired in this country, and under the bang for the buck, we see a complete redistribution of that money. And guess what? In tax cuts, we see those tax cuts go very, very disproportionately to people on high incomes. So when Maurice Williamson says, bang for the buck, what does that mean? I congratulate him, because maybe he's not up with the play of this pretty sinister stuff that this government's doing. And he said he's not up with the play, and I appreciate that. I know that he's actually been quite a rebel at times, and I'm saying to Maurice Williamson, be a rebel again. Say this is not a bang for the buck. Because what we're seeing in terms of members who stand in this House and say that this is the best bang for the buck you can get, we know that's not what's happening. Yes, do we commend efficiency in the health system? Of course we do. And in fact, that was the way that the Labor government was going. And there were two purposes to this bill, Mr Speaker. One is to get the Health Quality and Safety Commission, and the second is a mandate for collective purchasing across the whole DHBs. And we actually, of course, if it's efficiency with purchasing, with the delivery of services, we in Labor support that. But if it is at the cost of local people, of consultation, of people having a say in their health services, then that is something that we have serious concerns about. And in fact, Mr Speaker, I would say that Labor voted for the bill to go to Select Committee, and we are not opposing it at this stage, Mr Speaker, but we are putting on record, as did the Green Party, that we are putting amendments up to this bill that ensure that democracy, that ensures that local communities are having a say in the health delivery in their regions, and their communities, and their cities. And I hear the previous speaker, Nikki Wagner, saying that under National we are seeing so much more happening, more bangs for the buck, that we see health services, the public health system, the hospitals delivering far more on-time services. Well, can I say, Mr Speaker, that is not the experience that we've seen. It's not the experience when we, day after day, question the Minister on the health cuts under this government. The health cuts. And if we look at throughout the country where we've seen older people, their $5 a week meals or $5 a day meals, the home help that might be just a couple of hours to ensure that they stay at home, we've seen those services cut. We've seen them cut. Not just in Southland, but actually when we were visiting our providers in Waitakere just a couple of weeks ago, the same thing happening here. So when I hear members say on the opposite side of the House that this bill is all about bangs for the bucks, I share with Maurice Williamson, what is it all about? And I think that was certainly the question the Minister answered, and that is a question that we share on this side of the House. If we look if we look at the problem, we've got no, as I've said before, no problem with raising the quality, with raising purchasing powers, but what my colleagues have said before me is what we do have a problem is setting up another bureaucracy and actually taking the democracy out of consultation, out of communities knowing that their health delivers. And why would I say that? Because I know in Waitakere, how do we get a full-service hospital? We got it under a Labour government, and we got it from a community that lobbied for it, that went through rounds of consultation and said, this is what we want in our community. Now, this government is not doing that. And we've seen additional tiers and layers. The government that was going to get rid of red tape and bureaucracy, introducing things that we, whilst we say if it is going to save money, we don't want that money to be spent on inappropriate spending. We would rather see it going into health services. Because, Mr Speaker, I think it's pretty rich if members come into this House and say we're getting far more bangs for our bucks when we see cuts throughout the country. Now, Tony Ryle calls it streamlining. That's the new term now for cuts. We call it a cut in services and delivery, a cut in older people getting their home support under the district health boards because funding is cut there. But this government calls it streamlining. And it could equally be said that this government calls it bangs for their buck. Well, I'm saying to you, Mr Speaker, we do not think that cutting services for older people in New Zealand, for the many calls we've had to our office of people who are not getting, despite what Nikki Wagner said, getting seen and getting fast service and getting their operations on time, to say nothing about the escalating costs of doctors' visits. We do not see that, Mr Speaker, as bangs for your buck. But what we do see is a government that is actually possibly, and we wouldn't say this categorically, but as many of the submitters raised, setting up something that's quite risky. The senior doctors in their submission to the Select Committee called it risky, erratic, a restructuring proposal in the Southern DHB. And across, we've had from the nurses' organisation that they believe that it was that these proposals were removing nursing leadership from the region. Now, Mr Speaker, I do not, and I know that we in Labour do not think that cutting, and peace to you, Mr Speaker, we do not think that cutting services, that cutting particularly to older people in our communities is a good bang for the buck. And so we are going to, of course we are supporting this bill as it is. We supported it going to Select Committee, but the members of the Select Committee, certainly from Labour and certainly from the Greens, listened to what the submitters said, and that they will be putting up a number of amendments that ensure that should this bill come into effect, that it is democratic, that it does actually, it is not another level of bureaucracy, that it does actually meet the needs of the community, that it does ensure that local communities have a say. Yes, can we ensure that health services won't be cut for older people, that people will get the medical care and the surgical care they deserve and need? No, we can't assure that, but we certainly can assure the public that when this bill comes back in the committee stages, that Labour will be putting up amendments that ensure that the local voice is heard, that the people who know about their health services, because they're living them and breathing them, are part of that consultation process. And I would hope, Mr Speaker, that in fact members of the government do listen to that, and that that when we're looking at bangs for the health buck, that we look at the big picture, that we ensure that New Zealanders receive the health care they need and deserve, the health care that they invest